Okay, guys. So this is Dr. Harpal Baines from the Harpal Clinic near St Paul's Cathedral in London, and I not begged, but really wanted these guys to exhibit at the summit. One, because when I met them probably about 4 or 5 months ago, I really loved what they did over at the clinic. I was looking for a clinic in London that did some biohacking things as well as hormone optimization and cryotherapy and IV therapy. As you all know, that I'm a big fan of IV therapy, and yeah, they're awesome clinic. So I really asked them nicely to come to the summit because I believed in what they did, and I thought it'd be nice for them to do vitamin drips at the summit, which is something that we didn't have last year, which was a shame, but this year it's going to be bigger and better, and we're going to what they're going to be doing at some point. So shall I call you Harpal or shall I call you Dr. Baines? What would you prefer?
Harpal, please.
Harpal it is.
Harpal's good, yeah.
Yeah, deal. Okay, cool. So let's just, in your own words, I mean, tell me, what is Harpal Clinic and what do you offer into who?
Well, we started about by basically, it's a passion business. I learned about bioidentical hormone and functional medicine, which is root cause management, and I'd never heard of it before. Had researched it a little bit, couldn't find anything when I first started out. This was, of course, quite a few years ago. Decided to go to the US to get trained up because I was one of those doctors that try a little bit of something. I'd get up to, I'd get as far as I wanted to get in it. And if it wasn't tugging my heartstrings, I would leave and I would try something new. So I've actually had a lot of experience under my belt in a lot of different fields to the point where I was quite satisfied and had to move on. And for this, went to the US. At that point, I was actually working for a male sexual dysfunction clinic, and I was doing psychosexual medicine, and that was very heavily what I was part of. And I was just thinking of testosterone replacement therapy because it sort of fitted in really well with what I was already doing. Mm-hmm. And went to the US with the idea that, you know what, I'll learn about testosterone, not too bothered about estrogen, progesterone, and the rest of it. God knows what else they're going to tell us within those training courses. And all I remember was that I sat down there for those days with my mouth literally open the whole time. I couldn't believe what I was hearing. It was unbelievable. I couldn't believe that medicine could be that way. And that's why I became a doctor, I suppose. I think most of us do, to make a difference, to really make a difference, not just peddle pills, for lack of a better way to put it. And so it really, I knew I didn't have a choice but to do something about it. And because I didn't know of anyone else doing, practicing that form of medicine in the UK, I knew that it would have to be a case where I would have to set up myself. And I had no clue about how to run a business. So what I can say is ignorance is bliss. I'm so happy that I just went ahead and just did it, because it's one of those things. It doesn't ever stop. The learning never stops. And like, just when you think you're getting somewhere, you figure out this whole new area that you have absolutely no clue about. And there you go. So it's perfect for my personality.
Awesome. So, I mean, like, what is your, like, tell me, just, I guess, a quick bullet point rundown. What are the exact services that you offer then, would you say, for the layman walking past, just like boom, 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 like a menu card, I guess?
Yeah, so at the moment, if someone were to ask me, like, in a nutshell, what do you do? Because what I do is apparently very confusing. I would tell them that I could get a person who is ill, chronically ill, not acute, chronically ill, I could get them well. And for someone who is well, I could get them to slightly Superman, Superwoman, super person capacity. Okay. And in a nutshell, that's what we do. How do we do it? We do it with, of course, nutrition, bit of biohacking involved, with hormone optimization, full body optimization, and we have IV nutritional therapy as well. We have other things like infrared saunas and a cryo chamber. We'll be getting a hyperbaric oxygen chamber in at some point as well, and all these other things. I've got to be quite careful about what I bring in, but the idea is that at least you'll have a one-stop shop, for lack of a better word, where you can go in and you know that we have done the research in trying to figure out that, you know what, my sauna has to be EM radiation minimum. It has to have a food grade glue. It has to have pesticide free wood. The cryo chamber that we have has to be has to go up to the right temperature. I mean, we have done all the homework so that you don't have to, you know that when you come into us, you will get the best. For IV therapies, we're very, very careful about who we choose to work with. It has to be, you know, short shelf life. I don't like it pre-mixed. We prefer to mix it ourselves. We prefer to make it the way it should be made, preservative free and everything else. And so that's sort of what people can get when they come to us. And then you can dip your toes into it and just try it out with something like intravenous therapy, where it's you know, the consultation is sort of complementary if you were to carry out a treatment. If you want a little bit more, we offer at the moment 2 types of consultation. Basically, one which is focused on the issue that you've come in for. So let's say if you feel like you have low testosterone, or if you have chronic fatigue, or if you're adrenally fatigued, or whatever it is the reason you have, we can just target on that. Or we have another one which is comprehensive one, where we take a step back, we look at everything, we do a very comprehensive panel of labs that I've created for the clinic, which isn't easy to come across. And of course, doing the labs is one thing. The most important part is the interpretation of it and putting that together, where you put it together with a history of what the person has come up with, and creating a jigsaw puzzle. So a lot of times when people ask me what I do, I would tell them, like, you know, the reason why we have such long consultations is generally it runs from a minimum of 45 minutes, but quite frankly, usually runs to about an hour 15, is that we put, it's a jigsaw puzzle. The patient, I remember going to medical school, and it's like one of the consultants I really like actually told us, is like, you know, all you have to do is listen. The patient tells you everything. And that's exactly what's happened. If you take the time and the trouble to sit and really, really listen, ask them questions, but really listen to them, the patient tells you everything. You'll find out more than you ever can. And there you go. It's a jigsaw puzzle. Brilliant.
It's funny because I hear this from always from good doctors or specialists, where they say sometimes you just have to sit back and listen, and the client or the patient will tell you everything, and like they're telling you in their own words. It's just a matter of unmixing them. And so it's really interesting to hear you say that again, because it's like the people I put in my journey that have actually asked me this, or have actually said this to me, are the ones I consider to be amazing. It's funny because a practitioner I worked with for many years, he's I guess he's more of a nutritionist background. He said exactly the same to me. You just have to listen sometimes. So it's really cool you said that. It made me smile. So how would you say that, like, obviously you said that partly in your previous answer, but how would you say that the Harpal Clinic differs to others that are in their quest to optimize people's health? I mean, for me, it's obvious, but to hear it from you, for the guys that are listening.
I'm really curious how it's obvious to you. For me, and this is actually 2 years of experience, this is what I find. I actually think the fact that we do bioidentical hormone replacement to be one of the bigger things that actually differentiates us. The reason is because it's such a scary word. Hormones are a scary word. You say hormones, people think cancer. How misleading is that? And what I really, really like about hormones is that actually the disruption is it's so common these days. It's almost difficult to move away from it with the pesticides that we eat, the environmental toxicity, and stress more than almost anything else, which almost none of us can get away from. The impact it has on the rest of your hormones is so huge that it's close to impossible to get away from. And this is where I use conventional medicine into what I do as well, where in the sense that sometimes what I do is a little bit of band-aiding in the first few months. The reason being, band-aiding gives me a domino effect. Once you start feeling good about something, you then have the motivation and the drive to start doing other things, to make those changes in your life. I totally understand when someone's like, oh no, you shouldn't this, maybe do it slowly, nutritionally, using functional medicine practices and the rest of it. I'm not very patient by nature. It's too slow for me. It's too slow for me. I keep telling myself, if that were me, if I was a patient, how would I want it to be? And I'm like, I don't want to be sick for a long time. I don't want to, let's try a few more months of this. I cannot do that to me. So I don't see why I should do that to someone else. And
Mm.
so the way I normally practice is that I give people the best case scenario of, if you want the quickest result, this is what you do. I'm going to put everything in there. So sometimes the menu of options that they get can seem quite a lot. And then I'll put it back to them. I was like, if you ask me to pick the top 1 or 2, I will. If you tell me you want to do it all, then yeah, results will come about much quicker.
Interestingly, so a friend of mine in this space said to me the other week, I want to work on my eczema because my skin keeps on getting funny, etc., etc., etc. And I was like, okay, cool, well, it's in a long haul fix, but I need it fixed now. Like, I need it fixed now. And I was like, well, this is where you combine the long haul fixing the gut and supporting the liver with something that you do immediately. So and it's like, no, but I need it right now. I was like, well, if you do something right now, it might cost you later. So balancing the two, you have to know that you can't keep on using the same things over and over again, expecting different results. So it's really interesting. And like, a lot of people do need a fix right now, but I think balancing the two is always really important.
It is. Yeah, it's a little bit about buying time, really. I mean, for lack of a better way to put it, the thing is the time that I buy. So you find that there's a phenomena where because a lot of the hormones share the same pathway. If you're particularly stressed, remember, stress is going to kill you. You don't have to make babies if you're stressed. That's how the body thinks. Very, very simple, So if you're under stress, everything's going to be diverted to making more stress hormone, not so much the others. And therefore, by sort of optimizing the rest of that area, you now find that life is just that much better. The pressure gets taken off your body to do so much work, so to speak. And the best part is that the healing goes on underneath. So it's actually, it's kind of like Band-Aid, but yet it's not as well, because eventually your body kicks in and takes over. And it's about understanding when to step in and when to step back out again.
Yeah. Okay. Well, I'd just like to say hello to Dr. Nasha Winters, who's just joined, by the way. She was a speaker with us last year. I love Nasha very much. So hello, thanks for joining. And also,
yes. Oh, hello. I know her.
And just to say that, guys that are listening, as per our social media posts, we're giving away a 60-minute health optimization consultation with Harpal today for the best questions. So keep the questions coming in, and my team are WhatsApping them over to me, so they're popping up on my screen over here, so that we can answer them in a bit. So keep them coming in. Before we move on, Harpal, someone's just put in a comment about it's Eve Miller. I was told hormones are the reason for aura migraines happen. Would you agree? Well, before I ask Harpal, I'd like to answer that, because I'm a sufferer or ex-sufferer of aura migraines. It is when you are dehydrated to the max, in my opinion, and it only ever happens when I'm really dehydrated. If I have a pint and a half of water with a heaped teaspoonful of Himalayan rock salt or Celtic salt in a glass of water and chug it quickly, I find that the aura goes and the headache doesn't come on strong. So that's my personal biohack for it. I don't know, Harpal, if you have any opinions on aura migraines or if they're hormone related, but from my experience, they're very, very hydration related.
I think as with most things, it's multifactorial, but I don't think it's completely due to hormones, no.
Okay, cool. Well, I hope that helps, Eve. Okay, cool. So let's just move on to the next part of why I chose you guys. And I think I covered part of this at the beginning of our live, is basically because you brought a lot of these biohacks into one place in a clinic that is run doctor-led, has some alternative therapies, has hormone optimization, which is such an important thing. A lot of people that reach out to me on my Instagram say, oh, I'm chronic fatigue, I've got no energy, blah, 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 and my hormones are all over the place. It's like, well, actually, you can have these things looked at from most angles at Harpal Clinic, and that's one of the things that I really love about them. Also, the space in the clinic is actually really nice. It's in St. Paul's. It's really nice, so you can go for a really nice walk along the Thames afterwards. And obviously the service offering that they have is awesome, and we'll come on to what they'll be doing at the summit in a minute. So Harpal, just for you guys, I mean, why did you want to exhibit at the summit? What made you choose us? Because I appreciate it's a big cost to come to an event like ours, but so what was it that made you want to come?
I don't think there's anything quite like you in the UK. You're ahead of the game. We are heading in that direction as well. Like, as you can see, I'm wearing the Aura ring, and we are starting to head towards using trackable device, trackable technology, and that's the direction we want to go in. So it was a no-brainer. It's exactly what the kind of things we want, the kind of people we want to be with, the direction we want to go into. So I actually think, I mean, it's come to the point right now where if someone is, for someone who's chronically ill, we know that we are able to help them for maybe 70% fairly easily, and then 30% will be slightly harder, and then, you know, the journey is much more. In fact, for me, the interesting part moving forward is, how do I get a person who's already fairly well to be, you know what, supremely well, really great? And that's actually not well studied at all. People always study sick people. What about the ones who are fairly okay? And I'm really curious about that. I'm really, really curious about it.
Well, it's interesting because Martin Tobias, who's the CEO of Upgrade Labs, he's one of the guys that helped the summit get a turbocharge, I guess, or an upgrade. He got into biohacking because he went to the doctors and he said, "Doctor, I want some help. I want to be, I want to be optimized." And he said, "What's wrong with you?" And he said, "Nothing." And he said, "Well, there's nothing I can do." He said, no, tell me something. I want to go away with something. I want to be better. He goes, "Well, there's nothing wrong with you, so I can't help you." And it's just really interesting how, I think, for me, health optimization or biohacking I got into it because I was ill. Then you get to the point where you just then want to flourish, and every last 1% that you can get hold of is amazing, because you realize how good life can be when you are optimized: mind, body, soul, energy, emotions, everything. So it's really nice that a lot more people are branching out to this. And I guess it's preventative healthcare. It's servicing your car before it breaks down, opposed to waiting for it to break down, or whatnot. Cleaning the gutters once a year, opposed to waiting for them to overflow and flood the house. And and I think we're just coming around to this way of thinking now.
Yeah, I mean, also I practice 80% of what I preach. Not 100%. I need my 20% of naughtiness. So there you go. But I'm curious. I want to try things, and I'm one of the, I think, few practitioners who actually got into this being well. Most other practitioners I know have gotten into this, it's been because they have been ill, or but it wasn't that way for me. So I actually feel I have a lot more energy. I already thought I was in a pretty good place, meaning health was never really something I thought much about until I got into this, and suddenly I went from being okay to being actually really good. And it's interesting because it's something that never even occurred to me. And now that I'm in a, I would say, a really good place, I'm able to practice without detriment, if that makes sense. I'm able to trial different things before I you hear about all kinds of things, but I'm able to try it, and then I can actually tell my patients from firsthand information. Why not? So,
well, I love that you just said that, and I'll tell you why. Earlier on today, I did a podcast with Sim Land. It was a follow-up podcast. We haven't done one for a year, and yeah, one of the things that came up, we were talking about working with a functional medicine practitioner and like a professional, because too many biohackers just go in at all angles, firing in all directions, just trying everything they can because they're dopamine dominant, and not working with a medicine practitioner. And I think that's really important. But one of the things that came up was, and it's funny, it came up today, it was that I said, if you work with a functional medicine practitioner or a doctor that has gone through what you're going through, they know how to work on you. Because the analogy I used was, if you learn to drive a car from someone that's never driven a car, but has read it from a book, how good of a driver will you be? I was like, you want to work with someone that's had, has worked on things themselves, and has applied it to their lives and lived it, opposed to just a general doctor that hasn't necessarily applied any of these things to their lives, or not worked with hundreds of patients with this exact issue. So it's about finding someone. So I love that you just said that, because it really, I know that you eat, sleep and breathe it. I mean, this is one of the first conversations that we had when we met. Actually, I remember you going into it and just saying, "I love this stuff, like all these things." And I was like, when I learn something new, I try. Yeah. So it's that obsession. It's that obsession which makes you really good at it. And that's one of the things that really, as you can tell, I remember from when we first met.
It's a different kind of a candy shop, isn't it?
It is definitely. So the topic for the day is IV nutrient therapy and the role in hormones and health optimization. I mean, I think one thing I just want to touch on is, obviously you do I come in to see you for that. I specifically like magnesium sulfate. I had magnesium push the other week, which was amazing actually, and I've been having it once or twice a week ever since while I'm in Germany. I find it works very, very well. The eyelid twitch that I had goes the day that I have IV push. I've been stacking it with Procaine while I'm here in Germany because that's much more normal to have, and I find that puts me into parasympathetic mode and I sleep absolutely beautifully. But for everyone else, like, how do you think that the IVs that you do, and if you want to list out a couple of the things that you do there, how you feel that fits into the role of hormones and in health and optimization in general?
I suppose in the simplest possible way, for reaction A to become reaction B, for reaction B to become reaction C, and so on and so forth. There are there are things that facilitate those things. This is where your nutrition comes in. Normally, I suppose if we were living about 50, 70 years ago, it wouldn't be that much of a problem. The problem these days is, like, even if you eat the best quality organic foods out there, you're forgetting that the soil is quite depleted. It's usually, like, intensive farming. Fine, it's still organic, but it's still depleted. How many of us can't really afford organic? A lot of us can't. And it becomes a balance. It's really difficult. And not only that, stress causes a lot of gut issues, which means you now also have the potential of absorption. So you have a depleted soil, you have vegetables, even the best quality vegetables, which are most likely to be a little bit more depleted than normal. You have a situation where gut is not absorbing it as well. You have the day-to-day stress, you have environmental issues, all kinds of toxicity. There's a lot of alcohol drinking in the UK, and it's culture, it's tradition. It's fine. However, it's very toxic. So the body always thinks, if you put yourself, if you start thinking like a human body, you'd be like, oh my God, let's target the most dangerous thing first. So all resources are always going to be pushed into getting rid of the most toxic of substances, the most dangerous of substances, like stress. I mean, you have to run away from the tiger, you're going to die out of it. So that's where all the nutrients go. What happens to the rest of it? We just don't have enough, and therefore this is a huge place where the IV nutrition comes in, because it bypasses the tummy. You get rather large doses. Jury's out there as to how useful that is. We have all kinds of people saying all kinds of things. All I know is one day when I have a bit more time, I'm going to sit and study a lot more. But at the moment, a lot of it is anecdotal, what people tell me. And at the end of the day, it's a needle in your arm. It's not the most pleasant experience, but people come back. Why are they coming back? Because they have found a difference. And through my patients, I'm experiencing as well. I personally use it as well, especially if I've got kids. So once in a while, they're going to bring all kinds of things back from the school. And I find that, if I'm ever feeling a little bit off, that's it. I have a drip and I don't fall sick, frankly, because I don't have the time to fall sick. And so it's not just what my patients are telling me, it's my own personal experience and common sense of why you would be depleted in these nutrients. So it's really, really useful. And then, of course, you've got people into veganism, vegetarianism, and the rest of it. All this has an impact. And if that's how they choose to live their lives, fine. But, let's mitigate it a little bit. There are things that can be done. And for some reason, lots and lots of genetics and epigenetic factors, which affects quite a few conversion of various nutrients within your body. Antioxidants is another big one that, it gets used up so quickly. People who fly a lot, I keep telling them, that there is such a thing as cabin fever. There is such a thing as, like it or not, a little bit of recirculated air is going to pick up particles from the engines. And that's toxin. That's toxins. And your glutathione is used up drastically for that. So even glutathione is really, really relevant, and plus other antioxidants. So.
Well, it's very true. I mean, I think with things like magnesium, I believe it's about 5% uptake when you take it via supplement form. But when you take it via IV, you take up significantly more, like 90 milligrams of elemental magnesium when you have it in an IV push, from about 1,000 milligrams in total. And I think that's obviously a significant amount of more magnesium. And I find that whenever I have it, and this has been repeated since we last did it, is from magnesium push, I find that I obviously get the flush as my circulation gets better and the muscles start relaxing, and you feel it in your diaphragm, and it starts actually in my neck, goes to my thyroid goes warm, my diaphragm goes warm, then then my balls and my prostate get really hot. It's really insanely strange, but I mean, it shows that the areas where I actually store my tension in my muscles, where they're usually tight, and when I go for a massage, that's the areas that they usually focus on. And I don't mean my balls and my prostate, by the way. More of the shoulders and around this area gets really tight. But when I have the magnesium sulfate, I find that I don't need that. I don't need those massages anymore. So I think for that. And then in terms of the antioxidants, I completely agree. I mean, I usually have a vitamin C IV after flying to LA or back. I also try and get a session of hyperbaric oxygen therapy in, and also I get plenty of time grounding, because obviously the free electrons from grounding, which in terms of cortisol, there's been studies showing that it helps level cortisol late in the afternoon. So I think, see that there's a question come in, which we'll answer in a minute. But in terms of, if you're not getting your shoes off and you're not grounding and getting the free electrons from the earth, you're not going to be getting those free radicals, pairing with the free radicals and reducing inflammation, which also helps cortisol. So that's something I'd look at if your cortisol levels are high in the afternoon, getting your shoes off and getting in the grass for half an hour, and also go and see Harpal as well. But yeah, glutathione is obviously a big one, and depending on your genetics, whether or not you produce enough, or if you are vegan and you're not getting enough B12, you should look at glutathione, obviously. And these are all the things that you do, which are actually staples pretty much for me for many years now. You do basically the things that I love the most in terms of IV form. So yeah, so it's really cool. Well, should we go on to a few questions, Harpal, and let's just see what we got rolling in, because I've had about 10 or 12 come through. So let's start from the bottom. Sherry T, does your clinic provide testing for deficiencies for IV drip recommendations?
Not as a routine. I think it'll be too expensive for people, but anyone who wants testing, of course, we can do it. Not a problem at all. But we don't insist on it before we come up with a regime. We go with what's the commonest, and that usually works for majority.
Okay, cool. What are your recommendations to improve bone density, mineral density?
Bone mineral, then estrogen, even for men, which means aromatization from testosterone. Depending on your age, of course, be very, very careful with taking calcium supplements, just because it's a part of a triage of, if you're taking calcium, you have to make sure your vitamin D is up to speed, your K2 is up to speed, and all of that. It works together. If you only take calcium with nothing else, it's fast forward speed to atherosclerosis and calcification of your...
Yeah, big time. I mean, it's something actually Dr. Dominic Nichwitz speaks about. He's the biological dentist that will be speaking at the summit this year. He has a bone healing protocol. He's the world's leading ceramic implantologist. So obviously being metal free and having a ceramic implant, which I'm having done tomorrow, and by having the right bone healing protocol, which is obviously magnesium, a little bit of calcium, and what else is it? There's a whole vitamin K2, vitamin D, making sure that your vitamin D is optimized. And he finds that the people that don't have optimized vitamin D and vitamin K don't have such a good success rate with bone integration from the new ceramic implant. So it's part of his protocol. You have to have it tested before you go to see him and have any work. And the bone growth from that is very, very good, actually. And I've seen it firsthand. So I completely agree, which is awesome.
That's the nutrition side of things. But honestly, if you haven't had the time to study the effect of estrogen and testosterone, actually, because it converts to estrogen on bone density, I would say it is probably the most powerful.
Wow. Cool. Awesome. Thank you. So for someone taking relatively high, which is someone who is relatively healthy, which IV drip would you recommend taking into consideration? Well, I mean, I just answered this one quickly from a biohacker's perspective. We don't need a doctor for this one. Basically, it depends on what you've got going on. If you're fatigued or have any health issues, then you know, you would look at certain things. But if you haven't really got anything going on if you're relatively healthy. What do you need? If you get a cold, for instance, or feel that you've got the cold or a flu coming on, vitamin C, high dose vitamin C is my favorite personally. But what would you say to that one, Harpal?
Well, we actually have a few that I would actually go for the basic Myers. I would always add glutathione. I just think you have to. On top of that, like, so for someone who works out a lot, really well, works out a lot, we have a specific amino acid formula for sports and muscle building. So it's like, instead of taking a creatine powder and the rest of it, this has been designed for that. We have another one, which is Hot and Haar. That's in German, of course. It's hair and skin, I think. And so that one's, once again, for someone quite well, but like, you know, they're like maybe just want to optimize the skin and the rest of it. There's another one, which is an essential amino acid formulation, where just generally, if you, for whatever reason, believe that, you know what, if you're eating, you don't really understand the kind of quality of the meats or the kind of proteins that you're getting, these are the most essential of all the amino acids that you could actually ask for. So those would be for someone who's well and who just wants something to optimize. If nothing else, we also have people coming in for glutathione push. That one is actually a really interesting one, because I think all of us are deficient in glutathione, and because it's something that human bodies make. The older you get, the more depleted you are as well. And that's a really good one to do it as a push. 15 minutes, you're done.
Yeah, glutathione was a big win for me, actually. It took me a lot of courage to do it, because I got a history of metal poisoning, and it can stir things up. But I went for it once upon a time, and it was wonderful. I mean, I was skipping down the road afterwards. So let's just have a look at some other questions, because there's some nice ones here. Bliss gratification: how effectively detox and heal the liver after chronic Lyme disease? Lots of steroids and antibiotics. I'm doing IV with glutathione, vitamin C, alpha lipoic acid. What else can I do?
Yeah, it's a bit complex. We actually currently just started working with a German company, where if there's a really complex history, we will present it to them, and they will design something alongside us where we would give it to the patient. So if this person's interested, come in, let us know enough so that, you know, we have something to submit to them, and they can actually design. And it's absolutely fascinating how they work. They get a panel of, I think, 10, 12 doctors, and every week they sit down once, discuss a whole range of patients. As long as we give them enough of a history, they would actually design something. And it's very early days, of course. This whole thing started just before the pandemic, and it's affected things a bit, but we are definitely going to be working with them. They also use our supplies in Germany, so at least we understand that quality wise it'll be fantastic.
Awesome.
Yeah.
Awesome. Okay, awesome. That's really good. Really good. I love that concept of having several people in a room and discussing a case from all angles. It reminds me of House. If you remember with Hugh Laurie, like all the brains coming together to solve something that other people can't solve on their own. I love that.
It is actually fairly common in hospital medicine, which is my background, of course, where, you know, especially in orthopedics, I also remember my background surgical. Every Monday morning, that's it, all the slides are up, and the whole group will be there discussing all the fractures and whatnot, and who's coming in, who's going out, what came in over the weekend. And so it is actually a really common way. And I think we've lost a little bit of that. And so that's something which we want to bring back at the clinic.
Yeah, awesome. So this is I'm not sure if this is a bit complicated, but I'm going to put it out there. We can pass on it if needs be. And Anna, from the question, it might be that you need to have a consult with Harpal directly, but her question is, do you have any advice for early surgical menopause? I can only get low dose estrogen from GP, not testosterone, and I'm only 34. Thank you.
Oh, I would do the whole estrogen, progesterone. You absolutely shouldn't not do progesterone. They tell you don't need it because you don't have a uterus. Not true. Have a Google about where else you get progesterone receptors. It's not just in the uterus. The benefits of that are huge. So I would, you know, estrogen, progesterone, testosterone, these three things, you really do need it. If you're really lucky, you might be able to find a sympathetic GP. It's not easy that's kind of why we exist. But I would also go one step further and have a little look at the DHEA, the pregnenolone, all the precursor hormones, and see how that side is. Surgical menopause, you have to question why. Obviously something fairly traumatic leading up to it. Adrenals needs to be looked at. So there's quite a few things that needs to be done, really. And then of course we'll look at the nutrition and the rest of it. So this is like fairly standard stuff for me. It's
for you, yeah, for you. I was just about to say let's say traditional. It's not for traditional doctors. They just say, here you go, tick the box, and this is it. They don't necessarily understand it or can't navigate it. They haven't driven their car, the car to tell you how to drive the car. They've read it from a manual from something that was written 20 years ago, and can't necessarily help you in today's standards. That's why for Harpal, I mean, this is so flipping brilliant, because she knows this inside and out, back to front. Again, why obviously chronic fatigue and hormone dysregulation and things like that is such an important topic, and I hear it so often, which is why this, Harpal is such a great fit for us in the conference this year. So let's just have a look, see if there's one more question we can have for a minute before we push on. So I still have mercury fillings. Would you recommend IV to detox from mercury, or is it risky to have these fillings? Can I start with this one, if that's okay, Harpal? I have a massive history with mercury specifically, and it's about a 9 or 10 year journey for me. I would say if you've got any mercury in your fillings, amalgam fillings, do not do any detoxification, just support your body. Do not put it through pulling out more mercury from the fillings into your body. Support your body and get those fillings out. See a biological dentist. There's one in London called NDU Clinic, which is Dr. Goran. He's a good friend of mine. Or there's Dr. Dominik Nischwitz in Germany, which is who I'm here to see in Germany at the moment. He is speaking at the summit, but do not do mercury chelation therapy. It is my personal opinion for me, and I'm not recommending anything to you. Just make sure that you chelate once your fillings are out. That's what I would say. Later on, IV is a good way of doing it, and also Quicksilver Scientific do a good liposomal alpha lipoic acid as well. But you could just work on having binders such as a good clean chlorella sauce, or bentonate clay, or activated charcoal, something like that. And then supporting your body with a little bit of glutathione IV maybe is what I would do personally anyway. What do you think, Harpal?
Before almost anything else, I actually see this quite a bit at the clinic, where someone comes to me years later and they've all the symptoms of chronic fatigue and the rest of it, one of those vague, they have a little bit of everything. Looking back, I always take a dental history, always within my consultations. And you almost always can associate the removal of the mercury fillings within 6 months to a year, with all those symptoms coming about. And the way I see it, it's like, people get onto a health drive usually when they're not in a very good place. And that is the absolute worst time to take any, to remove any filling. You have to be in a good place. You have to have a healthy body before you even contemplate. And that's missed quite a fair bit. And so if someone came to me, if I were to, if I think that some of the symptoms may be due to mercury, or if they eat too much fish, which you really, pescatarians, I'm finding that to be quite an issue these days, because we have so much fish, you just don't know where it's coming from. Organic fish is even worse, I'd say. So in these patients, I normally look to see where they are. I would maybe, depending on where they are in terms of their health journey, I might spend anything from 3 months to a year to get them to be in a really good place. Once they're in a really good place, at that point, that's when I would consider, I would tell them, what, now may be the time to take the fillings out. So please be very careful in this. Don't just take it out, especially when you're not feeling too great. It's actually safer in than out. It's not worth doing it when you're not in the best place. And in the process of getting well, that's probably when nutrient therapies would work. And in that instance, lower doses of glutathione and the rest of it actually can make a difference. So there's a few phases of it, I would say.
Yeah, I agree. I would say see a biological dentist first and get their opinion, and then come for IV after. Don't just dive in. But mercury should not be messed with. It should not just end of. The thought of it being put into people's mouths in the first place is just nothing short of bonkers, in my opinion. So yeah, getting it out is just as bad. Okay, cool. Let's just have one more question, because there's been so many come in and I don't want to just ignore some of these good ones. What can you do with the possibility of arthritis if it only affects the elbows? That's Eve Miller.
Usually one of the questions I ask a lot of my patients is, do you have any niggling or nagging complaints? One of those things that comes and goes, but kind of always there and kind of always in the same place, it's usually a big telltale sign of something else going on, and for whatever reason the body has decided to target on that one joint. So you could have one of those joint pains that comes and goes. You could have a skin rash that's almost always in the same location, brain fog, migraines, headaches, and all of that, and you can never associate it. You generally don't know. Very commonly it's actually a food issue. And it's fascinating. So it's going to be a case of like, let's figure out why. And this is, I'm assuming it's not a trauma of some sort or repetitive stress injuries. So if you take that out, it's almost always an issue with the gut.
Okay, cool. Yeah. Okay. So someone's just saying, I'm looking to have cavitation surgery. Do you have IV drip protocols pre and post surgery? Now, Harpal and the clinic would be able to do that, but you would need to, in my opinion, have that under the supervision of a biological dentist, and they would probably give Harpal the protocol specifically based on what you've had going on in your mouth and your mouth history. That would be my take on it, but I don't know if you agree, or if you say that they can just come to you.
I mean, we do have, unfortunately, that quite a lot of the biological dentists tend to cost more as well. So a lot of these people, a lot of dentists are actually aware of the whole Mercury side of things, but they don't know what to do in that instance. And if that is your only choice, yes, we do have protocols.
Yeah, awesome. No worries, Sherry. No worries, Eve and Gary Dread. That's no worries. This is exactly what we're here for. So that's it. That's all we can answer for on the questions, guys, because we've got to wrap up in a minute. This is actually the longest live and Zoom recording that I've done yet, and I'm really happy. I know I could go on forever with Harpal on this. This is just so good, especially with all the questions coming in. So thank you, guys. So where can people find you, Harpal?
Oh, we're stone's throw from St. Paul's Cathedral. We're just there, right behind McDonald's. Perfect location, and we're in between two pubs. Can't go wrong.
It's like, yeah, leave there unhealthy, walk into your clinic healthy.
Exactly.
So the website, so on Instagram it's at Harpal Clinic, as per up here somewhere. If you guys click on it, so follow Harpal on there. And your website, Harpal, what is the web domain? Is it harpalclinic.co.uk?
It's just harpalclinic.co.uk.
Yeah. Perfect. So if you go on over there, guys, now if you mention Health Optimization Summit, we've got one. So it's, here we go. This is an interesting code, BOGOHP. So that's a buy one get one free HP, which is buy one get one half price. Now, for those who want to book an IV drip, we'll also add on either B12, glutathione, or magnesium. Wow, that's a good offer. Thank you. I hadn't seen this offer before. For those who want to book a nutrient injections, B12, B cocktail, magnesium, vitamin D, intramuscular injections and things, the first will be full price and the second will be half price, basically. One offer per customer, non-transferable. Just mention Harpal Clinic and HOS to claim. So I just want one final thing before we pick the winner from the best question, who gets a consultation with you. And I'll let you have a think about that in the back of your mind for a moment. So at the summit, you're going to be doing IV therapies, and you're going to be doing, I believe, and correct me if I'm wrong, vitamin D testing and potentially vitamin G.
We want to do, point of care vitamin D testing, and we're looking into more as well.
So I think why this is so good for me, and this is something we discussed, and I hope it does come together quite nicely, is because there's been a lot of studies around certain viruses that have been going around, and how it's linked to low level of vitamin D. And I know for myself, I like optimal vitamin D levels, and it would be good to get your levels tested and then potentially get vitamin D. Is it push or is it intramuscular or something or other?
Oh, that's intramuscular. It's
intramuscular.
Yeah. It's fat-based.
Yeah, so check your levels, and if they're low, then get a shot, which would be good. It's one of the things that I like doing. So that's one of the things, obviously vitamin C and various other things, which will be more details shared out in due course, but you heard it here first. So Harpal, question-wise, tell me, which question do you think? Put you on the spot.
Oh God. I have to remember.
So I'll just give you a quick skip back through because I've got it all listed here. Let's have a look. The migraines question, Where are we? What
I'm
about?
thinking the Mercury question, actually.
Really? Okay, let's just have a quick look. Which one was it? Hold on, where are we?
Number 2, was it? Were there?
I still have Mercury fillings. Would you recommend IV detox? That one.
Oh, was there another one?
Let's have a look. I think that was it. Yeah, that's the one that we've got on Mercury. Yes, and then there was also the detox after limes.
That's the one. That's the one.
Yeah. Okay. Cool. So bliss gratification: how to effectively detox and heal the liver after chronic Lyme, steroids, antibiotics, glutathione, alpha lipoic acid, and all those bits. So, Kirsten, who is on my team, if you could get into contact with bliss gratification, and then we will hook you up, Harpal, with her, so you can do a consultation. So, congratulations on winning that. Yeah, excellent. So, is there anything else you'd like to add, Harpal, before we wrap?
Yeah, we're currently doing remote consultations for we're open sort of on a limited schedule at the moment, most Wednesdays, for those who would like to come into us, but otherwise we are actually doing remote consultations almost daily.
Amazing.
So
amazing.
For those who want to.
Thank you. Okay, guys, so go to harpalclinic.co.uk and see if you need to book a remote consultation. Bliss gratification. There you go. Congratulations on winning your prize today. For those of you that aren't watching live today, sorry you missed out, but put your comments below and I will do my best to answer any questions that come in after it's been posted, because we're going to edit this and put it up onto our social media, and I will share out on my wall as well. So wishing you all very well. Harpal, I'll stop recording and end the live, but if we keep on the line in a second, and that's just so I can say goodbye to you properly. I'll post it just